Hello and welcome to another episode of Chat with a GP. My name is Dr. Soda, and today I will be covering everything about men's health. Well, not everything, but we'll be covering a lot. It's great to have you here, and you may not have realised, but last week was Men's Health Awareness Week. I had a chat with Dr. Bird, and it was quite clear that actually we're not really driving this conversation despite it being Men's Health Awareness Week. It was all about prostate cancer and prostate related conditions. Now, prostate cancer is one of the biggest killers in men. It tends to affect men as they get older, and it's not just prostate cancers, but it's also other things around prostates that can cause problems, including enlarged prostates, which can cause difficulty with passing urine or urinating more frequently, and also increase the risk of infections. Not only that, there are other prostate conditions that can affect people younger as well as older. Now, I'm going to cover a little bit about prostates at the end, but really what I want to do is talk to you about men's health overall. I'm going to tell you today some stats around men's health. I'm going to tell you some of the reasons why I think these stats perpetuate in society and some of the reasons behind them. And thirdly, I'm going to be vulnerable today. I'm going to tell you a few stories about myself around men's health, and I'm going to share them with you because I think it's really important that we talk about these things. So, some really important stats. 80% of suicides are men in the UK. 71% of heart attacks under the age of 65 are men in the UK. And finally, 67% of people overweight in the UK are men. And that's despite only 10 to 20% of people accessing weight loss services being men. So why is this the case? Now, I like to think of there being three key reasons why this occurs in terms of men and themselves thinking about their own health. The first is I really do believe in society there is a stigma, and men feel that stigma about being vulnerable when they get sick. I also think that there's an increased stigma still, despite the mental health conversations and some amazing work being done around the country, around men's health, around mental health. Secondly, I think there is a lack of awareness. There's a lack of awareness between this public health messaging around drinking less, not smoking, eating healthier, not being overweight, moving more, and how that leads to diseases or illnesses. And I want to show you how they connect, and I'm going to tell you about that with some stories later. Thirdly, I think men present later. They ignore things much more so than women do. Now, that's a massive overgeneralization, a stereotype. All those three reasons are a stereotype, but all three I think are relevant when you compare a whole population of men compared to a whole population of women. Now, there are some other things as well. It was Men's Health Awareness Week, and we missed out on an opportunity to drive a conversation. But it wasn't just individuals on the ground. It was also big organizations. It was the NHS. It was other people too. And I'm not here to be critical of any organization, but what I would like to say is that because perhaps men aren't talking about it, it doesn't get picked up in the media and it doesn't get talked about further. So here's an opportunity to keep talking about it and recognize that there are some specific conditions that affect men more so than women. And they're not just related to the anatomy of men, i.e. prostates. They are other things as well. So I've mentioned around suicides, I've mentioned around heart attacks, and I've mentioned around weight. All of these three things are related to two key areas in terms of health when we think very broadly. One is mental health, and the other one is metabolic health. Now, both of these are lifestyle related to an extent, especially mental health. It can be partly lifestyle related, but of course, there are many other reasons why someone might be experiencing poor mental health. And these conditions are difficult to treat. They're not episodic. They're not simply walking into your GP surgery, getting a medication, and suddenly feeling better. In fact, it's the opposite. It takes time, and often it takes time to even understand that there's an issue. Time to start instigating change, time to make the change, and finally making sure that change is sustained to then not lead to these adverse outcomes. Now, we're all humans, and humans tend to think in the short term, whereas a lot of these conditions occur over the medium and long term. It's very hard to connect ourselves with the public health messaging and how that is then leading to conditions that might not develop for 10, 20, even 30 years down the line. I'm just going to take this opportunity to introduce myself properly. My name is Dr. Kieran Soda, and I'm a GP primarily based in London, and I specialize in lifestyle medicine. And I tend to focus most of my energy on mental health and metabolic health. Now, that's conditions such as anxiety, depression, and burnout, but also cholesterol, blood pressure, fatty liver disease, preventing cardiovascular disease. I'm going to take you back to 2017. So in 2017, I had just enrolled in the NHS Clinical Entrepreneur Programme. I had also started an executive MBA at Warwick University. I was recently in a new relationship. I was moving from London because I was trying to buy a flat in Warwick. And finally, I was building this new startup. You could say life was very busy. There wasn't really much time to rest, but I was taking that gung-ho approach. I was reading a lot. I was learning around business skills, and I was also learning around alternative ways to do healthcare once I completed my GP training. But this lack of rest caused some issues. It meant that I wasn't eating properly. It meant that I was moving less. And in fact, moving from London to Warwick raised some wider issues that weren't what we typically think of as lifestyle medicine or even medicine generally. My social sphere had completely changed. So my normal networks of people that I was seeing, I wasn't seeing anymore. I was in a town where I was so busy trying to build my company at the time that I wasn't able to assimilate myself in the town. So I wasn't making new contacts. It got to a point where the business was very stressful. There were HR problems, and it was starting to burn me out. I was working 7 days a week. Working 7 days a week meant that I wasn't resting and I wasn't doing the things that would help me heal, help me rest, help me be healthy. Now, also in London, I used to cycle everywhere. And suddenly in Warwick, I realized it was far from everywhere that I needed to be. So I needed to get in the car and drive. Now, all of these things were ultimately impacting my mental health at the time. And I couldn't see it clearly in terms of all of it together, but I could really see what was going on because, of course, I'm treating patients as well. So I could see kind of the impact on me. I'd had a depressive episode back in my early 20s. So I kind of could see the signs. But I was stuck in this catch-22. I was stuck with trying to get this business up and running, trying to make sure I keep up with the demands of the MBA, paying the MBA, paying my bills, and also going to work as a GP. It became more and more difficult as my partner was in London and I was in Warwick. And I remember I walked into the GP surgery and I knew that I was depressed. I knew that I needed support. And this is where things get a bit difficult when it comes to healthcare provision. And I think we do need to do better in this country. So I went into the GP, saw a GP registrar who is a junior GP, who's training to be a GP, junior to me. And I remember the conversation so clearly. And I remember sort of putting my hands up in the air and being like, well, just give me the drugs or I quit my job. And I'm not going to quit my job with the startup. So right now, I guess I'll take the drugs. So I took the antidepressants. Took a while to kick in. They started working. It got me going. It hadn't treated the root cause of my condition. It hadn't treated why I was getting to this state, but it was helping. It was essentially a very, very good plaster for a time. But I noticed that occasionally my mood would elevate with these antidepressants and I would actually push myself too hard. And in fact, it would make me often go out more. It would often I would be drinking more alcohol than I would normally. And I have a family history of having elevated moods in the family. So I knew that this was a risk. So eventually I was trying to manage the side effect of getting just the right dose to stay functional, but not too functional and not over functioning so I'd burn out even further. Secondly, I was getting symptoms of erectile dysfunction with this medicine, which is a very common side effect. And then I was also starting to gain weight. So a number of different things were happening. By 2019, I had a fully functioning company, CQC registered, nationwide, up and running, and I was known as Mr. Viagra on the internet. But I was really unhappy. I was burnt out and I was quick to flare. I was not a nice person to be around. The relationship ended. The company closed down. I'd spent all my savings. I was in debt. I owed the business a large amount of money, which thankfully was written off. And I was essentially isolated again. I was a member of the tennis club in Warwick and I went like twice to the tennis club. I couldn't even leave the flat the anxiety and depression was so bad. The social isolation of being in a place where I didn't know anyone was terrible. I want to go back to that GP appointment, because at the GP appointment, yes, medicines were offered, but you're probably thinking, well, what about therapy? Yes, therapy was offered, but I was offered online CBT. And as you can imagine, in my case, I just didn't see that was an option. In fact, I didn't see it helpful at all. And conversely, when I think about it now, I'm not even sure psychotherapy would have been the right approach for me at that time. I actually wonder whether coaching to help me deal with some of the active problems going on in my current life would have been really, really helpful. But it just goes to show there's no one way of helping with mental health. So the online CBT didn't work, but I was very grateful to being given the opportunity to be part of the NHS Practitioner Healthcare Programme. Now, the NHS Practitioner Healthcare Programme, if you don't know about it, is commissioned by NHS England, was started by GPs, and that has really helped me initially at that stage to get to a point. But even that couldn't help because they were unable to offer me continued sessions. I'm very grateful to have been able to see a psychiatrist, clarify my mental health issues at the time, and essentially I was fully burnt out. I'm grateful for the practice in Dulwich Medical Centre to enable me to have very regular income during COVID. So how did I get better? Well, I got better by doing a number of different things, and this is what I really, really want to convey to you. I got better by eating better, by moving more, by sleeping better, by getting a routine, by looking at my behavior and my habits. That was my lifestyle. But now what about the mental health side? Well, I managed to come off the antidepressants. All the side effects went away, every single one of them. I was able to lose weight much faster. My libido came back, things that are really important for our health. But also it wasn't one type of therapy. So I had psychodynamic therapy provided through Practitioner Healthcare Programme. I had mentors from the Practitioner Healthcare Programme. I had mentors from the Royal College of GPs. I had coaching from Warwick University. And then I had a coach from the NHS. And finally, I sought Eastern type therapies to help me. I did find that a lot of the therapies within the Western world were very logically focused, very thinking focused. And actually what I probably needed was to go deeper. And I found that I had some childhood traumas, real childhood issues that I needed to work through. And I found a therapist, really amazing person, who helped me work through my chakras, helped me understand the Eastern side of looking at mental health, helped me understand the chakras in conjunction with Maslow's hierarchy and how they're so interlinked together. And then also we did some deeper energy work, including using techniques which are now utilized within the Western hemisphere of mental health treatment, including eye movement desensitization and reprocessing therapy and emotional freedom technique. Now they tended to work on my subconscious. Now it was a number of different things, but it's just to show you that it's not one way, not one person that helped me recover. One of the key things that I did with my coaching was to realign my values and my purpose. It took me a few years to realign my values and my purpose to know what I should be doing now. But now I'm very clear in knowing that I should be doing lifestyle medicine, which I'm doing, that I completed my MBA, which I did. And now I'm really moving towards a clear focus, clear purpose, and clear goals in my life. And I'm very clear in the way that I live my life. I make sure that I do look after my lifestyle. And I want to push that over to you guys and be very clear that you should be looking after your lifestyle too. Now that's not all. In 2020, I was nearly pre-diabetic after losing 5 kilos. So it's quite likely that I was in the pre-diabetic range for a period of time. When I found this out, I went on and lost another 7 kilos. I'd already lost 5 kilos by that point. So I lost 12 kilos. And for my little body weight, now I'm 64 kilos. That's quite a lot of weight to lose. But I did put on a couple of kilos and now I think I'm on a much healthier weight. But I got my HbA1c down from 41 down to 33. I got my HDL, I doubled my HDL cholesterol. I lowered my total cholesterol. I lowered my body fat percentage from over 20% to 12%. I was able to really, really improve my metabolic health. And it's the same factors that helped me from a mental health perspective that helped me with my metabolic health. And that's something that's really, really important. When we're looking at mental health from a lifestyle perspective, you're also looking at your metabolic health. And when you're looking at your metabolic health, you're also treating your mental health. Now, Triple whammy here. I was very unfortunate in 2020 to develop something called prostatitis. And my gosh, I do not wish it on anyone. 3 months of antibiotics, 6 months of pain. It was horrendous. I do think a lot of the conditions that I went through were stress mediated. Of course, the stress and the burnout led to the depression. The stress would have raised my cortisol levels, and the cortisol levels would have raised my glucose. And we know independently when you're looking at stress, it releases glucose into the bloodstream. So I would have had a persistently higher glucose as a result of that. All of that would have been driving my appetite, and my metabolic hormones would have been out of sync, which would then drive an increased risk of developing these conditions. And finally, prostatitis. Well, I do think stress was probably a factor. I think it probably led to an initial infection by reducing the effectiveness of my immune system. So look, I hope that is really helpful. I hope that you have found something interesting from that. The key thing I want to convey is look after your health now. Take home that public health messaging. Look to lifestyle medicine to treat your conditions, because actually, if you treat things early, you can prevent the longer term effects. The reason why we treat diabetes is not to treat the blood glucose level. The reason to treat diabetes is to prevent you having kidney problems, heart attacks, strokes, and all the other conditions. So if we can improve your mental health, improve your cardiovascular health, maybe we can reduce that disparity between what's going on between men and women in terms of some of those health disparities. Information is available. I will make sure I mention a couple of those places and things that are helpful, especially from a metabolic health perspective and from a mental health perspective. Anyway, I hope you enjoyed time with me, and hopefully see you soon.